Hi there, Dr. Ryan Walter, Regeneris Medical in New England Hair. There was a recent article in the New York Times called "The Hair Loss Drug Rewriting the Rules of Masculinity." And what they were really talking about was finasteride and some of the other drugs that we use in hair loss. And of course, in today's world, we use a lot of finasteride and dutasteride to curb hair loss over time. And we also have a lot of other medications and other modalities, including regenerative medicine. And we really are living in a great time in which we have lots of modalities to slow hair loss, and that's spectacular. But there's still a lot of worry about finasteride, and I get that question every single day. One of the things that's really important to understand is that the hormone that we're talking about that is harmful to the hair follicle is DHT. It is downstream from testosterone. A very small amount of your testosterone is converted into DHT, and there is an enzyme that is blocked that converts that small amount of testosterone to DHT. That's where the mechanism of action really is for finasteride. So we're just blocking an enzyme that slows the conversion of any of your testosterone to DHT, thereby lowering significantly your DHT levels, and then in turn decreasing the adverse effects to the follicle. So the mechanism is very clearly understood. It's one of our most understood treatments that we have for hair loss. A lot of the other cellular therapies that we do, although very interesting, are a little bit more complicated and difficult to explain. This is really simplistic in the way we understand it. The nice thing about it is that it's universally usually very helpful, particularly in the early stages of hair loss, but there are some people that do have side effects. So I wanted you to read the article. It's a nice article. I thought it was pretty well balanced, and I think it'll give you some insight into some of the issues that we're having. But I think the most important thing to understand is that in large practices like myself, large dermatology practices that have thousands of patients like we do on this medication, we rarely see anyone with serious side effects whatsoever. And we, by and large, have huge benefits. Huge benefits, very low side effects. That's usually a medication that I want my patients to take most of the time. The real thing to understand is that you shouldn't have fear of the medication. You want to have someone like me, you want to have a doctor helping you manage these problems, and that's the whole purpose. So going online, type of blah, 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 getting on medicine and then dealing with side effects on your own, you're never going to do well, right? So come see us. That's what we're here for. That's what I'm here for. I want to help you. I want to guide you. I want to make sure you understand what's best for you and your hair. Okay, so great article in the New York Times. I just wanted to give you a shout out because we don't see these hair articles very often, so it's nice when they do come out. Encourage you to read it, encourage you to learn more, encourage you to follow me and learn more about what we have to say about the do's and don'ts of what to do about your hair.